Objective 34 says discuss special needs of the adolescent and older pregnancy family. With the adolescent pregnancy, many of them are unmarried and they're less likely to seek early prenatal care because they are embarrassed or afraid of seeking prenatal care or letting anybody know that they are pregnant. They are more likely to smoke and have poor nutrition during pregnancy, and there's a greater risk for poor pregnancy outcomes like low birth weight babies and gestational hypertension. The older couple, there's been increasing numbers of older couples having babies over the last 30 years. There is an increased risk for low birth weight babies, premature births, and multiple births. But the older couple is usually more financially independent and more accepting of the pregnancy than the adolescent pregnancy. Goals of childbirth education are to ensure a safe birth for the mother and the child by promoting good health habits and reducing risk factors, teach health habits that can continue after pregnancy, educate the patient in self-care for pregnancy, provide the actual physical care for pregnancy, and prepare the parents for the responsibilities of parenthood. I think we do 4 out of the 5 of these goals of childbirth education very well. I think preparing the parents for the responsibilities of parenthood is one that we do lack in the medical field. However, the what to expect when you're expecting and what to expect for the first year and what to expect for the second year books have really helped out with that as well. Why is childbirth education important? Well, one, it provides actual education to individuals. And when people are educated, they have less fear. When you have less fear, you have less pain. And so it helps prevent pain and fear from the childbirth process. It also helps individuals ask questions that they are wondering about and also helps them feel comfortable with the childbirth process in general. Objective 35 says formulate nursing diagnoses and interventions related to psychosocial needs in pregnancy. In your NANDA book, you need to look up the following client problems and formulate nursing diagnoses and interventions for each problem. For example, prenatal testing. Prenatal testing, a good one would be deficient knowledge related to lack of exposure, basically, to the prenatal testing guidelines. And so your interventions would be provide pamphlets with information about prenatal testing, identify when prenatal testing will occur, and that type of such. Please look at pregnancy, prenatal care, prolonged gestation, and PICA in your NANDA book. Objective 37, outline intrauterine fetal death, including etiology, diagnosis, and medical management. We will discuss this in the complications of the newborn unit, which is Unit 8. Objective 39 says explain nursing and medical assessments designed to promote fetal well-being during pregnancy. The first one is an amniocentesis. First trimester amniocentesis or early second trimester amniocentesis are usually looking for some sort of chromosomal analysis. Third trimester amniocentesis are usually looking for fetal lung maturity. An ultrasound can be either abdominal or transvaginal. It uses high-frequency sound waves to visualize the fetal and maternal structures. It can be used to detect pregnancy, ensure fetal well-being, and help diagnose problems with pregnancy. Please go to this YouTube video to watch the video on ultrasound. This is also on page 192 in Chapter 9 in your book. A non-stress test is a non-invasive way to monitor fetal well-being. It uses the electronic fetal monitor. It takes about 20 minutes to complete. You should see accelerations. You should have 2 accelerations in 20 minutes for it to be a reactive non-stress test. Again, please go to this YouTube video and watch the YouTube video on non-stress test.